Wilson. I remember last time I made an error. I said Mrs. So it's Miss Wilson. She's here with us this morning inside Casualty 911, along with a guest boy. I see your guest open her eyes, boy. Janelle open her eyes like, wow. Okay. She guys, yeah. Anyway, welcome inside. Let's go, Miss Wilson. Morning.
Good morning, everybody. I guess Alan is in happy mood. What can I say?
Well, that's the best way to be, eh? You have to be positive, you have to stay positive. You have to be happy. Make yourself it starts with you.
Yeah, it starts with us. And let me just say, kudos to all those who participated in sports yesterday at our grounds in Soufriere, Erlan. It's always nice to have these national events in our very own community. Um, our children showcase their potential, especially our students from Soufriere Comprehensive School. Very good effort, I must admit. For those who are not there physically, I hope many of the parents took time to watch it live and to share on to our very own community members and so on. Let me say good morning to all our listeners in Connery, Soufriere, Choiseul, all our bus
Oh yes,
drivers.
Pato locked on. Big up Pato. Morning. Yeah, shuttle driver that is.
Oh, he's a shuttle driver.
Yeah.
All right, wonderful. Our taxi drivers, OJs, Chanel, everybody that is locked on, we would like to say thank you so very much for listening to our program. For those persons on Facebook and so on, and those persons who do not have the opportunity to watch it live, but however, they go back on YouTube and take a look at the program. We're always welcoming feedback and on a topic that you might want to hear about and so on. We can always bring the experts in to speak about the topic. We want to encourage the men to our men's health clinic in at Soufriere Hospital every first and third Wednesday of every month. So again, the men, we're hoping that you can come out to our men's health clinic. We're waiting patiently. Our numbers are currently low, so we're encouraging the young men or between the ages of 18 to come to our men's health clinic. You do not necessarily need to have a medical condition or be sick, but you can familiarize yourself with your doctor, ask questions, and get answers from a very good informed source rather than listening to things Powell Bolawi and then you kind of get it the wrong way. So again, our young men, we're urging you to come to our men's health clinic at the Soufriere Hospital. So today we have a very special guest on our program, and she is my colleague at the Bureau of Health Education. It's always a pleasure to have one of our colleagues here with us. It's not very often we have another member of our team on the radio program. So Janelle, welcome. I am so happy that you can be with us. So I will let you introduce yourself to the public.
Hi, good morning, everyone. My name is Janelle Alexander Dupre, and like Miss Louisa said, I am a health educator with the Bureau of Health Education under the Ministry of Health, Wellness, and Elderly Affairs. I'm very happy to be here. It's my first time, and we do a radio program, but I've never done the one in Soufriere. So thank you so much, Louisa, for inviting me. So I hope this session goes well and everybody asks their questions and be able to inform the public.
Wonderful. So Janelle, um, as we all know, this month is Kidney Awareness Month, and we have been speaking to our public about kidney health, and many people take heed. Some persons wait when it's too late, People tend not to believe that there is these conditions, and some people believe that it can never happen to them. And some people are discouraged by other people, when they seek medical attention. And we have a lot of people, just looking at the news. You see so many people on dialysis, so many people with kidney issues. And now under the PBF program, many of the hypertensive persons are now getting the doing the test, and many of them seeing that the issues that they're having. And the awareness is there, but we feel that we need to create the awareness a little bit more. So having said that, I will allow you to speak about what is the ministry's activity for this month as it relates to kidney health.
Okay, so every year, on the second Thursday or the third Thursday of March, uh, we celebrate World Kidney Day. And this year, the theme for international is kidney health for all, advancing equitable access to care and optimal medication practice. But for us in St. Lucia, we want persons to get more active and to get to know more about their kidneys and what their kidneys do for them and how important it is and how much it can change our lives if we end up having kidney failure. So for our sub theme this year is healthy kidneys, healthy me. And what we'd like persons to incorporate in their lives is to understand how important it is to have a balanced, healthy lifestyle. And healthy on a whole, when it has to both exercise, eating, our stress levels, how much we drink, we take into our body, because the kidney does a lot of work for us, and we excuse me, and without it, it can be quite a work in every day, because it would affect us on a whole on how we do our daily activities. The other thing we want to remind persons how important it is to drink water, to drink our fluids, to get that amount in our body, because our body is 70% water and it needs that water. Despite that, there are times where we may not feel like drinking, but we need to take in at least for the least 6 to 8 glasses of water in the day. So we are hoping that persons get the information through via social media. We have our Facebook pages right now on the radio show, also on Instagram. We will be sending those social media cards out for persons to get that information, to understand in an easier format. And also, we're hoping that we would like to go to business places, and we're inviting the business community within both the North and the South to contact us at Bureau of Health Education at 4685349, so we can set up a short session with the staff, because we want to get to persons where they are at, and we'd like to have sessions with them to educate them on kidney disease. And also, we would like to go to the different health centers and offer screenings where we do urine tests for persons who have diabetes and high blood pressure, to find out if their kidneys are releasing any protein or albumin in their urine, to see if they are in stages of kidney failure.
Okay, so that's a nice way to sensitize the public, and I agree. Actually, going down those avenues. You spoke about water in terms of hydration, but what's about fruits like watermelon? Those water based. Those. Watermelon. You
High
know,
water content
you
fruits.
understand all things like
Yes,
coconut.
all like you.
The electrolytes to kick in the body and all that.
So when I say water, I talk about water on a side, but also the fluid itself. So yes,
Hmm.
getting the watermelon, drinking the coconut water, the fruits that are mainly water based, all
Hmm.
those things are important. But we still need to get our our fluid, the water in itself,
But
if you get what I mean. So
I,
you you
I, I,
have the sorry, go ahead.
I was saying, well, I do understand that, but when persons preach about you have to drink what maybe 8 to 16
6 to 8 glasses
glasses
of
of
water.
water per day. Well, women and men, I think there's a ratio. There's a
Yes, there
ratio,
is a certain amount for
right?
both male and female. The
But
males have to take in at least a lot more water than the
exactly,
female.
exactly, and
Yes,
especially we have persons working in the extreme, like the construction workers,
exactly,
right?
exactly. But sometimes
So
even doing those things, we don't take in enough water at all. I mean, there are persons who do construction, and I've spoken to them, and if you ask them if they probably just one bottle of water, or if not, what they would end up drinking is some form of an alcohol, which
Mhm.
is does not help.
Like a
Mhm.
bear or
Alcohol,
bright.
yes, or bright, or um, other things that would not assist the body in helping it get that fluid that it needs. Drinking the alcohol and these things would actually cause damage than helping the body, despite it being in a liquid form.
So you'd say it's more detrimental to the health.
Yes, it is.
Let me tell you,
Yes.
there's something trending on social media saying that even a pint of salt, I guess, in your water when consuming water. No, I saw no for real. I saw it on Instagram. Like persons are simply saying, when drinking water, maybe just that one bottle, just that one bottle, not throughout the day. Like just put a little salt in it because wherever I feel the body not normally absorbs salt, so wherever the salt go, water goes. I don't know if that's just for just for maybe for publicity or just to content. I don't know. I'm
I
just asking.
think I'm okay. The body does need some form of salt, but this is something that we tend to take in already in excess.
Mm-hmm.
Mm.
Add it to our water in it would I don't see it as being something that would be beneficial because our foods already contain a lot of salt. And especially if you're somebody who eat a lot of processed foods,
Mm-hmm.
it would tend to increase your intake of salt. You need, for most persons, you don't even need a whole teaspoon for the basic
Mm-hmm.
of salt. And we take in way,
Way
way
more.
too much salt on a whole, whether it be our food, our normal food intake, plus our packaged foods, plus the drinks who add salt and sugar to it. So we already take in more than we need. And then now to drink water with salt again,
Mhm.
you are actually doing damage to your kidneys.
Yeah. While we are there, I'll just keep searching for that reel I came across.
Um, and I tend to agree with you, Janelle, because
I think we have somebody wants to make a contribution. So let's head to okay. Let's head to the phone line. Hi. Good morning. Hello.
Hi, good morning. My name is Rochelle Emmanuel.
Hello.
Hello, can you hear me?
We were currently we having a radio show. I've did you call to make a contribution?
No.
Oh,
Sorry.
all
Can I get
right.
the office number?
Well, you'll have to call us after the show. Okay, the show ends at 11.
Okay, no problem.
All
Thank
right.
you.
Thank you very much. Mhm. Go ahead. Sorry about it.
Janelle, I tend to agree with you because a lot of us it's a lot of processed foods, and even when we cook at home, we cook our meat with salt, we cook our ground provisions with salt, we cook our rice with salt, our peas with salt. Everything already have salt in. And for you to, add salt in the water, especially if somebody is hypertensive,
Right.
you understand? Why not, say, you put in like infused it with a fruit instead, rather than the salt content. You understand? I know some people really, really do not like drinking water,
Right.
and instead of the salt, another alternative is like you use a piece of, let's say, watermelon in the water, or some other fruit like a piece of mango or something
But
instead of that
to
salt.
some people that's taboo.
You understand? Than the salt content, because I know our population, people use a lot of salt. And even when you go to the wellness centers and you go out there, and people have that tendency to believe if the food doesn't have salt, it doesn't have taste. So you could really imagine our taste buds growing up as a child. We're so accustomed to the salt content. So, I mean, sometimes we have to be careful and what we see on social
Right?
media and these things, and do other research, and why somebody suggests such,
Mm-hmm.
and so on. It might not apply to us in our local context. Yeah.
Mm-hmm.
So um so Alan,
Yeah,
you'll
yeah.
have to do some further
Yes,
research for
yes, I
us.
will. I will.
So having said that, Janelle is clear. Yes. Janelle, I'm not sure if you were able to get a little bit of statistics for us as it relates to, what are our numbers in St. Lucia, if you got any. I know sometimes it can be very
Okay.
difficult to get.
So for kidney disease, there are different stages.
Mm-hmm.
We have a stage 1 to stage 5. So for us in St. Lucia, I cannot give the exact number, it's just an estimate, but there are over hundreds of persons and plus persons on the waiting list that are within the stages of chronic kidney disease. So there's chronic kidney disease, which is a gradual damage of the kidneys. That's why they did different stages, stage
Mm-hmm.
1 to stage 5. When you reach at stage 5, there are different levels also within there until you reach to what we call end stage renal failure or end stage kidney disease, where the kidney completely malfunction. It does not work anymore. You need assistance. So for us, within those stages from 1 to 5, we have over hundreds of persons. But for end stage kidney failure, we have persons who are on dialysis since they need assistance. And we have within a total of 187 persons who are on dialysis right now. And there are also hundreds of persons on the waiting list to get onto dialysis.
Wow. And I remember, was it last year or year before, when they opened the clinic at Mikud Wellness Center, and Dr. Mul Clark, our nephrologist, was speaking. And it's amazing, because at that time I took my dad to see the nephrologist, and it was like his filtration was, down by a little few points, and there was a little cause for concern. And when you hear the numbers, it's quite alarming. It was quite alarming that so many people are at different stages of kidney disease. And and persons hearing that, it was quite a shock to me, because um there are things, until it has not reached home, that you really do not take heed of. And when she mentioned the numbers, and like you said, the number of persons that are on the waiting list for dialysis, it was really, really um heartbreaking, because if you cannot get it through our public, our hospitals, that means you have to go and pay it privately, which is very costly. And that's one of the things people need to be mindful of, when it comes to dialysis. So
In mentioning that, sorry, Louisa,
go ahead,
in saying
Janelle.
that in because right now our public um, units are filled. a lot of persons have to end up going to the private clinics, which also are becoming filled, or if they are not filled already. So, with that being said, for someone to end up getting onto dialysis would be that whether or not um, they have an emergency, depending on the stage that they are at,
Mm-hmm.
and also if unfortunately that someone who's on dialysis already passes away. So that is the only way that any of those individuals would who are waiting would get onto dialysis. It's because dialysis is life support. Without the person getting their blood filtered by the machine, they would definitely get the buildup of the toxins in their body, and continuously that way will eventually pass away.
Yeah. But the good thing about it is let me just I do not want to jump the gun. A good thing about it is when my father was diagnosed at stage 3, he changed his diet around, and he made a 362. And at his age, he was disciplined enough to do all of that. And then the filtration level went back up to a very good reading. So, and that takes a lot. That takes a lot. I can tell you that a lot of discipline. So, Janelle, having said that, um, can you tell us a little bit? Well, you spoke about kidney disease, and can you tell us some of the signs and symptoms of kidney disease?
Okay, like a lot of conditions, some persons might not see any signs until it's on the later stages. But what the symptoms would tend to be like, you have a pain more often or less often than usual because the kidney cannot filter out the fluid. You have a foamy urine. You have a lot of itchy, dry skin. You're feeling tired all the time, nauseous, loss of appetite. You're losing weight, and you're not trying to lose weight. You're just losing weight. If you go into further stages of kidney failure, then you'll have a lot of problems with concentrating because of the buildup of all the toxins. Your body's not you're not able to focus as much. You have numbness or swelling in your arms, your legs, your ankles, your feet. Your aching muscles. You have cramping, shortness of breath because fluid buildup. Um, any vomiting, troubles to give you trouble sleeping, and also you'll have what we call ammonia, a kind of fishy like smell on your breath. So the person will be talking to you, and the smell of their breath is this kind of fishy, kind of ammonia like smell.
Oh, okay. Um, I know.
And you can see that a lot of in the early stages too, a lot of it can be symptoms for other things. So it's always important for us to go and get checked. You should get screened on a regular basis. And one of the things for kidney would be a kidney function test, or uh, gu- the glomerular filtration rate.
Mm-hmm.
It's through a blood test, or one of the simple tests would be that you just do a urine dipstick.
Okay.
Okay, so they just puts the stick in, test the
Mm-hmm.
urine, and then check to see if there's any protein coming out of your urine.
So, what are some of the risk factors for kidney disease, Janelle?
So our risks, once you have diabetes, high blood pressure, any form of heart disease,
You're trying to kill.
obesity, overweight, you have a family history of kidney failure, um, if you smoking, if you use tobacco, any form of tobacco product, um, if you've had an injury to your kidneys, which would eventually can form into acute kidney failure. And if you're not taken care of properly, then it can lead on to going to chronic kidney failure. All those things are risk factors for kidney disease.
Um, I I I know many of our sorry about that. We had some technical difficulties a while ago. General, I don't think many people heard the risk factors, right, Ulan?
Yeah, go ahead.
Go ahead with the risk factors. We had a little bit of
Okay,
technical difficulty.
no problem. So the risk factors would include diabetes, high blood pressure, if you had heart disease, if you obese or overweight, if you've had a family history of kidney failure, um, if you have any autoimmune conditions such as lupus, if you've had any sepsis or um, urinary tract infections that have not been healed, you have it for long lasting periods, all those things can lead to kidney failure.
I'm so glad you said about persons who are diabetic and hypertensive because many times, our diabetics and hypertensive tend to neglect themselves and they do not take the medication and or they take it when they want or they do not follow the doctor's advice as it relates to taking care of themselves and their bodies. And until now, when they do the relevant test, then they realize, okay, I'm now having an issue with my kidney. Now, that is the time a lot of them are, I wouldn't say in shock, but a lot of persons now want to do everything underneath the sun because I mean by the time they hear they're going, they're now developing kidney disease. It's like that's it for them. They want to do everything that they were supposed to do a few years ago, before they reach that condition. And I just want to say to people out there, when you go to our medical clinics and the CHAs, the nurses, the doctors speak to you and you feel or you completely walk out, especially if they tell you come back because they've seen high readings when it comes to your blood pressure, and then you don't come back, or you come back after a whole year or so thinking you can get away with it. Sometimes these are the issues in the long run that you can come across it with, especially with kidney disease, because that is what we're currently seeing at our wellness centers. Persons are afraid. They're afraid to be diagnosed with these conditions. They see the signs and the symptoms and they tend to ignore it. They go out there and take all kinds of um, medication, bush medication, what people say to them, what else, Janelle? Um, until they decide, okay, or they realize they really cannot take it again, they have to come to our wellness centers or our hospitals. And that's when reality really strike them. Yeah.
And that's the problem. We tend to do um a lot of that. We wait until it's the last, and then we expect to come to the hospital, and then after we work for them to work a miracle for us. But we are not miracle workers. We can only assist you with what you have. And if you're not taking care of yourself, then what would lead on is that everything would end up being damaged. And having high blood pressure, having diabetes does not mean that you have to have complications of the condition. What
Mm-hmm.
happens is because it is uncontrolled, you don't monitor it. You take your medication when you want. You say, "Oh, you're feeling better. Oh, that making me sick. Oh, that making me." It's either you have the feeling of some. If you're feeling upset, you take something else to help with the upset, than to go into the point where you lose your kidneys completely. So we have to look at it in both ways. And that is what the pros and cons of taking the medication. Yes, you may feel that at the point in time it's making you feel a little bit upset, but with the little bit it's a bit upset is better than having complete kidney failure.
Yeah, because a few times I've sat at the pharmacy, and those persons on this medication complain they have to go and they have to go to the bathroom too often to go and urinate, and this and that and that and that. But they don't realize that most times they're doing more harm than good. Yes, some of the medication might have some side effects, but then if you speak to your pharmacy, you speak to your doctor, they can better explain to you, or they can, change the medication based on your condition. And also certain things go hand in hand, like you said, the diet, the exercising, all of all of that is part of the package, rather than just feel you just on the medication and you're afraid of the side effects of the medication. So you have to look at everything in more of a holistic approach. And that is why, for Kidney Awareness Month, the focus is, as you said, is eating right, the exercising, drinking a lot of water. Because at our centers, they come to the clinic, you see them, some of them don't do what they're supposed to do. Even if you come for the medication and you're taking the medication, but there are other things that you're supposed to do. Are you really doing these things? You understand? Some of them are still overweight, some of them are still obese, some of them eat normal, they don't eat their fruits and their vegetables as they should. So then you might think that the medication is not working, or why isn't my pressure going down, or I've been taking the pressure medication or other medication for so long. How can I develop kidney disease? But are you doing all what you're supposed to do as an individual to help prevent that outcome? And that is one of the things we really want our patients to think about. And sometimes they don't really do until it's too late.
All right. Janelle, I got something to put at you. I feel a while ago you spoke about dialysis. Um,
Yeah.
when how would my doctor know, or when should me know, like what, like should I be on dialysis or a transplant? Because I know they have about kidney transplant and things. So when is it necessary, or at what time? At what
Okay.
part of this, yes, the
In
stage?
in St. Lucia, we don't have transplant.
Hmm.
Okay, the persons who get have gotten transplants here are, if we had a one of those missions, or someone who was willing to assist, um, or if the person has their own relative or somebody that that's a
No.
match, they're able to go to another country to do it. So we don't do transplants in St. Lucia. Um, when it comes to getting you on dialysis, it's either, if you depends on whether or not you're acute. So if you're acute, means that you just have the failure for a certain period of time, whether you need a bit of assistance, so then you'll get the dialysis. But for somebody who has kidney failure, depending on the stage, it would be at stage 5, and it would be that the person would be basically, um, put in simple terms, that they're in complete kidney failure. So the kidney cannot filter the blood anymore to take off the toxins from the body. That is when you would be placed on dialysis. Okay. And
Nice.
most persons at that, who have kidney failure, few of them still able to pass a little bit of urine, but most of them are not able to urinate anymore. They can't pee anymore.
I remember at one time, one of my friends, I think he had an issue and he had something called a stone. And for
Yeah,
himself, like
kidney
he,
stones.
he, he was afraid, like as if his kidney was failing him. So I know some, in case somebody had that in the head. So try, let's fix that now.
Okay, so somebody who it depends on how much damage is done and how long it has been in there. Okay, because we persons who tend to ignore a lot of things.
Mm-hmm.
But there is a possibility that it can lead to failure, kidney failure, but it's not that one of the first things that would happen, because there are things that can be done for persons with kidney stones. Depending on the size, the doctor will give you things, and for it to be passed out normally, and
Mm-hmm.
if it's um, on a large enough, then they will actually take it out for you. Okay.
Okay.
You, depending on what it is, then you may get, if you have need of the dialysis, then they would um use that, but that does not mean that you are going into kidney failure. Your kidneys still function.
All right. Very nice.
But somebody to have kidney stones, that is so painful. How can you stay with that for so
I've
long?
no, I've known of persons who stayed with the pain for a good while until it really cannot take it again,
Mhm.
and
Mm.
then decide to go and do something.
Honestly, a gentleman told me he had stones, and he crawled like a baby, to the hospital because it was so
Mm.
painful. Like it was extreme pain. But for persons to stay with that pain for so long, I guess, Lord have
Yeah.
mercy.
It's
So
fear. It's fear. It's fear of the unknown that causes persons to do a lot of things, even to our own selves.
that is so true. So Janet, is there anything else you'd like to mention out to the public as it relates to kidney disease and kidney health?
I just want us to remember how important it is for us to take care of ourselves. We only have one body. We are not a car. We're not a vehicle. We're not
Mm-hmm.
a house that can be suddenly fixed. Once we get a form of damage, that damage would be complete.
So you say there's no
It cannot be
renovation.
changed.
No
We cannot
renovation.
get a part. The part that we have to get, even if, like you mentioned, the transplant, that transplant has to come from somebody else. Somebody has to give it to you. You're taking a part of somebody. So it's better that we take care of ourselves. And even if we get that part, our body can reject it because it's not ours. You have to, when you get that kidney, it you have to be on medication. You have to be tested all the time. You still have to go and do the checkup. And if you go back to living the lifestyle that you used to live, the kidney will get damaged again. So I just want us to remember that we only have one body. God only gave us one, and we need to take care of it and value ourselves and value our health for us to live a life that we are happy with, that we can feel proud of being, and that we set down to our other generations in St. Lucia that how important it is that we take care of our health on a whole aspect, not just, like I said before, just the exercise and the eating and everything, but also our mental health, our stress, uh, for us to learn how to care for ourselves on a holistic basis so that we will have a healthy environment and a healthy community, a healthy St. Lucia.
But imagine that dread. You have two kidneys and both of them failing you. That dread, boy.
Yes, imagine that. Imagine that. That so goes to show how much we work our body
Hmm.
to the bone,
And of
that
course,
it would get, both of them would get damaged.
that filtration system, boy, is of utmost importance and of course very sensitive. So like you're right, man.
One of the things I want to mention is that
Uh,
our younger generation tend to.
mhm.
You were saying something?
No, go ahead because I wanted, but I want to ask her how can we keep how can we clean our kidney, like always keep it in, like clean, not in checker, but there's a basic things you can do at your home, at when you home. I know we spoke about exercise, we spoke about good food, we spoke about, but just to keep it clean and like get rid of all the toxins in there.
There is no magic pill that you can take, and after you say, I'll just drink that and my kidneys would be. And
Well,
even if there was that magic pill, you would still have to be taking the other things to help maintain it because it's just a one off.
mm-hmm.
So, for us to be healthy on a whole, we have to eat healthily. We have to eat our fruits and vegetables, get our five a day. We have to drink our fluids. We have to exercise. We have to, and trust me, I know it's not, I'm speaking to others out there, but it's for me too, because yes, it may be something that it's not easy. I'll not say that it's easy because we have so much temptation out there, but we
Mm-hmm.
have to take different small steps to make the changes. So if, for instance, um, for a day you would only drink a little small 250 bottle of water or small 250 glass of water, say, okay, for this week let me try to bring it up and drink a 500 ml, so I've gotten to that bigger size and I've gotten more, and we take small steps. I don't expect somebody to just go cold turkey and make changes. Take small steps, and those small steps we build on it, and once we build on those small steps, our body makes the changes. It's amazing what our body can do, because you may not see it on the outside, and that's what a lot of us always want to see. We want to see things happening on our outside, but it's not the outside. It's that once we get the inside working properly to its best, then the outside will show what is happening on the inside.
Right.
So once you make those small little changes, your if you have high cholesterol, trust me, it'll go down. Once you change your diet, if you start to exercise,
Mm-hmm.
those are the things that you would see first. If you used to always get infections in your urine, urinary tract infections, and you start drinking more fluids, and you ensure that you go to the washroom when your body's telling you you need to pee,
Right,
you start
right.
doing these things, you will notice that eventually you'll stop getting all those urinary tract infections, because now you're taking in the fluids,
Mhm.
you going to pee when you're supposed to. So it's reduced. So the body does what it needs to do on the inside first, and then the outside will eventually reflect
All
what
right.
it is.
I want to ask you a question. Do you know what is Votive?
What is there?
Yeah, a medication, a plant. What's that? Because someone is like you taking Votive for your kidneys. I don't
What
know.
is there? That one is new. Louisa, you hear that already?
I
Louisa,
know
you
what it
know.
is.
She
Well,
knows. She knows. She knows.
Tell me,
Volti.
Louisa.
Yeah, yeah. Louisa,
That's
tell
what you
us.
use for the craft for thing. I do not know what Voltiver, the make of Voltiver, although I know it's used for craft. I do not know what content it has in it. And I do not know what what
Medicinal purposes.
medicinal purposes it has. I'm very sorry to that person. I've never heard Voltiver for kidney health, and I do not know how to use it. I do not know how to use it. I know people use different stuff for urinary tract infections, but not the Voltiver. Um, so I cannot say much about the Voltiver. You
Okay, I'll go.
understand?
I will look it up. I have to
Very
find out
the
that
thing
information.
you use in the craft where they make the basket. It's a long green stuff, almost like it almost looks like
Oh, the thing they make to make the baskets.
yes. I've never
Ah,
heard anybody uses it for the thing for kidney health. So
okay. I
I
have
cannot
not.
help you. If I really do not know about that one. Um I was saying, people, you learn something new every day.
Yes.
But
I
some
must,
people say you drink arigoma for the urine, so I don't know.
I do not know.
Okay.
Arigoma,
Yeah.
Arigoma. I do not know what's Arigoma. Uh,
anyways, let's go.
but whoever it is, even if you're taking these
That person must be
bush
a
medicine,
whatever
a
herbalist.
herbalist, even if you're taking these herbs, but you have to know what quantity, the
Yeah.
effects of your body. Sometimes it's for one thing, but in another aspect, it can be very potent to your body, especially if you're a woman, a man. And these are one of the things we really need to learn when we take herbal medication. Um, because in growing up, you hear a leaf and a half for a child, a small leaf, a medium sized leaf, and all of these things. So you have to be mindful what quantity you put in what. Sometimes they tell you boil it, sometimes they tell you draw it. So these things, I'm really, really not en courant with all these things. I might know a few, but there are some things I really do not know about. Um, Another thing I
Yeah.
want to talk about when it comes to kidney health, Janelle, you were saying something?
No, I was just agreeing. I was just agreeing with you. Um, I'm not a good against herbal medicine. I'm all for it. I just want persons to know that they know the amount that they're taking because
Dosage.
medications that they are measured, so they have to know the dosage and how much they're taking. Because I've known persons who have taken herbal medicines, and I'm not talking about the ones that are measured and everything, but they've actually made the mixture and then all that and have gone into kidney failure itself.
Mm-hmm.
So I want persons
Cirrhosis of the
to
liver.
be careful. Yes, or cirrhosis of the liver. So please just be careful on how much that you're taking, and if you can go to see somebody who's trained in herbal medicine, preferably before you go and you still have to monitor. And it's not, and still the person will tell you this, not to go to mix the two um, medications together. So just be mindful of those things.
Okay, so the person that was giving us all those kind of medication is from Lagay. So good morning to Lagay.
Oh, the message from
Morning.
Laget so.
Mm-hmm.
Oh, nice. One of the other things I want to say is now we have a lot of our young people engaging into drinking alcohol at a very early age. And that's one of the things that we want people to
I'm
be
just
mindful
noting.
of, as it relates to kidney health. When you start so early, you're doing more harm than good to your kidneys. You're giving your kidney a little bit more work, especially when it comes to binge drinking on a weekend.
Mm-hmm.
You indulge in all that alcoholic content, especially our strong liquor and so on. So some people say, gasa mo ba whole case sabi me mo happy say tout ça. But at the same time, you're really giving your kidneys a lot of work to do. And I want our young people, imagine you start, let's say at the age of 15, you have been drinking heavily and you're not taking care of your body, because many of us, we don't eat, we don't sleep, and then we don't take care of our body the way we're supposed to, especially when we're young and so on. So we want persons to be mindful of all these things. You don't want, when you reach a certain age and you start feeling these things, the signs and symptoms, that's the time reality strikes. And as Jana was saying, your mental health is very important. The moment that you hear you diagnosed with a certain condition, one time it can cause additional stress to you. And then by virtue of that, you get even sicker sometimes, or you do not have good coping mechanism. And that's when you hear people say one life to live. So even if you're in that condition, they tell you one life to live, you might continue drinking and so on. So we want persons to be mindful of all of these things. We don't say don't drink, but I mean, you have to drink the right amount and so on. And as much as possible, if you could stay away from, these kind of um, things at a very early age. And the other thing is we also encourage our parents not to give the children those processed foods at a very early age. And parents find it very easy to buy a packet of corn curls, cheese curls, or anything, to put in the school bag, the lunch bag. And I think we at the bureau, right, Janelle, have been preaching that for a very, very long time. Instead of the juice, instead of, the box juice, instead of everything, give the children water in their lunch bag. And that's how it starts. If you start your children at a very early age, it's better for our children and so on. So, bearing that in mind, we might think, but it starts very early and it starts at home. People tend to say vegetables and fruits are very expensive, but we have been saying make sure you have your home garden. You can grow what you eat, and that's one of the things we have been encouraging people to do. Make some time. It can be very therapeutic when you're in your own garden, planting your own stuff, weeding. At that time, you're more relaxed. So there are different things people can do, and to ease out all this burden of all these diseases. And it starts at home, and it starts at a very early age. Janelle, you were saying something?
Yeah, what I wanted to add is that you said that, like you said, and I agree 100%. Our fruits, our vegetables, our all our considered healthy foods are expensive, but um, dialysis is not cheap. So you have to go 3 times a week, $500 for $500 for each session, and it could be have gone a bit higher right now since everything seems to be going up.
But the $500 is subsidized by our government
That
for,
depends. That's for the public, not private.
yeah, public is $500 and it's subsidized.
Right? It is subsidized, but it's still um, imagine that you have to leave work all the time. Your boss has to give you time to go and get dialysis. It's 4 hours, 3 times a week. So it takes out your time. And after you've done the dialysis, you're very tired. You don't have the energy that you're used to. You're not able to work the way you used to. Even persons that I've known who started out looking like me, my size, everything, and then by the time a few years have passed, you'll be wondering if that's the same person that you knew. Your whole body changes. There's not only the dialysis, but there's also medications that you have to take to maintain because your body, the kidney helps our body to make our red blood cells. And that means now you have to take medication to help you make that red blood cell. So you have to pay for that medication all the time. So it's yes, the food may be expensive, but taking care of the health is even more expensive.
And I tend to agree with you, Janelle. Like you said, the $500 is in our public service, but the private might be even a little bit more expensive. And that's what persons need to be mindful of. How do you sustain that kind of expense? I mean, look at us right now. Um, like everything we can say, things are getting hard. We hardly have money to do what we're supposed to do. Far less for someone that is sick and that has to pay that kind of money. Um, you know, is it per treatment or on a weekly basis?
That's per treatment,
Casualty. So you could well imagine if you go 3 times a week, it's like 1,500
the
every.
dollars.
Some of
That's
us
that's
have
somebody's salary
money.
already there
Yeah, that's
in a
somebody's
week.
entire monthly salary. So you could well
Mhm.
imagine, um, that cost incurred. And well, boy, I don't know what to say. So again, General, I know I said any fine words. We up to our 11 o'clock. Oh my God, the time went by so fast. I didn't even realize that.
Yeah.
So, anything else you want to say out there?
I think I've said basically everything, but I just want persons to remember to, for everything that we do, just take everything one step at a time. It's for ourselves, it's for our health. And once we are healthy, we are able to take care of other persons that are within our family. So, especially if we're the breadwinners. So, I'm just saying that, yes, taking care of to be healthy is expensive, but if you're sick, it's even more expensive.
All right. So I'm knowing that we celebrated World Kidney Day on Thursday. All right.
Yes,
I want to leave some tips here for folks locked on. All right. So don't overdo certain medications, including antibiotics. Eat a balanced diet. Watch your salt intake. Drink plenty of water. Like she said, yeah, you have to stay hydrated. And of course, exercise. You have to exercise. All right. Thank you.
So let me say thank you to all our listeners, especially Janelle, coming on the program. Janelle, I hope that you know, during the year, you get to come on our program,
In
especially
person.
Soufriere FM, and in person too, rather than staying up north, come down to
Yeah,
Soufriere, and,
I'll tell them to that
and
because you're bringing
come.
it yourself what springs.
Yeah, Sulphur Springs and the waterfall. You get to enjoy what Soufriere has to offer. You're at work, you'll be at work,
Yes,
but at the same time, having some fun in between. But it's always a pleasure, Janelle, having you here, and I hope during the course of this year that you're in the program a little bit more often. It's not, like I said, it's not many often that we get our very own colleagues at the bureau here with us. Let me
yes.
say thank you to all our listeners, especially the gentleman. Is it a gentleman or lady from Lague Babuno? Thank you so very much for listening to our program. Um, we hope that we can continue providing this information to all our listeners. We encourage persons to speak to their friends, persons abroad, family members abroad, to take some time and log on to Soufriere FM on a Monday from 10 to 11 and listen to our program. I would also like to say thank you to Ulan for being here with us today, and Romanus for providing us with the service of providing our link no matter what time we call and so on. He's always willing to assist. Thank you so very much, both of you and Soufriere FM, the staff of Soufriere FM, management and staff of Soufriere FM. Many times we say thank you to Erlan and Rome, but we forget the management and staff of Soufriere FM for allowing us, the bureau, to be here every Monday. So again, I wish everybody a wonderful week. And don't forget the tips that Janelle gave from the very beginning is the exercise, the eating right, ensure that you sleep well, yeah, and reduce your stress level, all right? So again, thank you so very much.
Bye, Janelle.
Bye, Janelle.
Bye.
All right, folks.